பரவாயில்ல சார்.
Good afternoon to everyone gathered here. We extend a warm and heartfelt welcome to our Pro Vice Chancellor in charge Medical Health Sciences and Dean Medical Dr. Nithinam Nagarkar sir, our Additional Registrar MSL Dr. T. Maithili ma'am, our Medical Superintendent Dr. Venkatraman sir, our Associate Deans, Heads of the Department and esteemed faculty members, and most importantly, our newly joined postgraduate students and their proud parents. We warmly welcome you all to the Postgraduate Induction Program for the academic year 2025-2026. Today marks an important transition in the academic journey of our postgraduate students. Postgraduate medical training signifies not only advanced learning, but also increased clinical responsibility, ethical commitment, and dedicated service to the society. This induction program formally welcomes you all into the postgraduate academic community of SRM and acquaint values, expectations, and standards that guide postgraduate medical education in this institution. We shall now commence the program by invoking the blessings of the Almighty. I request everyone to kindly stand for the invocation. Tamil Thai Valthu. I now request the respected dignitaries on the stage to light the lamp and set an auspicious tone. To formally welcome this August gathering, I invite Dr. J.S. Kumar sir, Associate Dean PG Academics, to deliver the welcome address.
respected Pro Vice Chancellor, Professor Nitin M. Nagarkar, respected Additional Registrar Maitri Madam, my fellow Associate Deans, Head of the Departments, dear parents, and most important dignitaries of the day, that the first year residents. Indeed, it gives me a great privilege to stand before you and extend a heartfelt welcome to the newest members of the SRM family. At the outset, let me congratulate you for securing a PG seat of a national or international repute with the best in all over India. It marks the formal beginning of a journey that will shape you into a skilled clinician, a thoughtful academician, as well as overall a compassionate human being. As you enter the residency program, your roles will change fundamentally. You no longer will be a learner, but then you will become a passionate care provider. Your advocates to your patients and role model for your juniors. The CRMIs and the undergraduates will look upon you as a role model. As well as within 1 year, as the time will fly, I think soon the next batch will be joining in very quick. So this is an important stage of your life and a cusp where you are going to, from a cocoon, you are going to change into a butterfly. SRM Medical College Hospital offers you a very good ecosystem, a high volume of clinical load, well-structured academic program, as well as multiple opportunities for research and innovation. You will be trained under experienced faculty across the departments. You work in multidisciplinary teams, and you will undergo a lot of rotations in your peripheral postings. And as envisaged by the National Medical Commission, you also will have the mandatory district residency program, by which you will have a hands-on training how to give a holistic patient care in a research-poor setting. Your training will be guided by principles laid by the National Medical Council, so it will be mostly it is going to be competency-based, and your faculty will be certifying the skills at the time you complete the course. Residency, as all of us know, is much or quite demanding. There will be long hours, there will be difficult cases to treat, and there will be some moments of self-doubt. In those times, remember 3 important anchors: commitment to patient care, commitment to learning, and mind you that you are not being allowed to walk alone. We are always there. Kindly seek help. We have a lot of counselors. We do have excellent counseling facility for all those students who feel that they are under some kind of pressure or stress which they are not able to cope up, especially in the first few weeks of joining the course. As you know, supporting each other and timely action will mitigate all those things that we already have alluded to in the morning hours when I talked about the roles and responsibilities of a postgraduate. This induction ceremony is just not a ceremonial beginning, but is also the reminder of the trust that the society, our institution, and patients place in front of you. Over the next 3 years, you shall sign notes that change the course of treatment, make decisions in emergencies, and participate in research that may influence and teach the next batch of students who look upon you as teachers and guides. On behalf of this institution, 3 promises are made to you today. A, you will see enough number of patients. Clinical load is awesome. You will definitely be challenged. And 3, you will never be asked to walk this journey alone. In return, we look forward of 3 promises from your side. Please show up, stay honest, and keep learning. If we keep these promises to each other, this residency will be worthy of the trust patient place in us. On behalf of the management, Additional Registrar, Pro Vice Chancellor, Medical Superintendent, and the entire faculty of SRM Medical College, we welcome you all, each one of you, and may your years be marked with hard work, humility, curiosity, and compassion. Welcome you all. Thank you once again.
Thank you, sir, for the warm and gracious welcome. To express our warm welcome, I request Dr. J.S. Kumar, sir, Associate in PG Academics, to felicitate our Pro Vice Chancellor in Charge and Dean Medical, Dr. Nitin M. Nagarkar, sir. I request Dr. R. Venkatraman, sir, Medical Superintendent, to felicitate our Additional Registrar, ma'am, Dr. T. Maithili. Thank you, sir. I now invite Dr. R. Venkatraman, sir, Medical Superintendent, to address the gathering.
Respected dignitaries on the dais, all the HODs, proud parents, and dear students. A very good afternoon to one and all. I think I have had an extensive 5 to 10 minutes talk with you rather than a presentation. So this is more of an official thing. So it is actually a great pleasure for me to welcome you all to this SRM Medical College. So ours is an NABH accredited hospital. Along with the nursing excellence, also we have an NABH nursing excellence, and we have a molecular lab, NABL accredited lab. Ours is around 1,600 bedded hospital, catering to most of all the super specialties we have, including interventional radiology. This is the latest addition which we had. So we have a good patient load, where good number of OPDs and surgeries are happening. And as far as deliveries are also very good numbers. In fact, we had one day around 26 deliveries per day also happened on a single day, which is one of the biggest landmarks for any private hospital that will take. So to tell you about the little bit of facilities available, I will request all the parents to visit the hospital. This is one time look at the infrastructure that is available, and we have the management is good and kind enough to provide so much of schemes to bring in more patients. So many investigations are being done free of cost. In addition to that, for all the inpatient care, we give around additional 5,000 rupees discount as well to this, is to encourage all unaffordable patients to get converted to be treated free of cost, so that they don't be denied treatment just because they're not affordable. So for the Valyame scheme, what we call as for the all pregnant patients who are getting delivered here, we are giving additional, all the treatments are provided free of cost, from the consultation to the medicines to the OPDs till delivery. Everything is being provided free of cost, including that. In addition, we will provide, as per the Valyame scheme, we give additional 20,000 rupees to the patients as well. So you are in a right place where there is good clinical load. This is what we are telling. We have a good clinical load. It's up to you to utilize it. So work hard. Never ever hesitate to ask for help, whoever it may be, from your HOD level to your associate dean to myself or dean sir. Never ever hesitate to approach you for help. So if you work hard, this is a phase where you are going to get trained. Don't think you are working here. You are here to get trained, so that when you leave at the end of 3 years, you should be a fully trained professional. My best wishes to all of you who have come here. So make best use of it. Thank you.
Thank you, sir, for your insightful address. Now I request Dr. T. Maithili, ma'am, our Additional Registrar MSL, to address the gathering.
A very good morning to all of you, dignitaries on the dais, parents, HODs, faculty members, and my dear students. A very warm welcome to all the students. I think our very opening program stands testimonial to the kind of atmosphere we have here, right? Seeing the PGs feel so relaxed and giving you a welcome performance is in itself shows what kind of environment we have here. And I think the Dean PG Studies has very beautifully charted out what has to be done and how it has to be done. 3 promises from us and 3 promises from you, which is very, very possible. And for the parents, yes, your children are getting into the next phase, but at the same time, stay in touch with them. Make sure you stay connected to them. And students, yes, you're going into your masters. And as they said, it is the next phase where you're going to be shaped where you're going to pick up your confidence, where you're going to pick up your, or rather, your individuality. This is who I am, this is how I will do my work. All these basic value systems should be ingrained in these next 3 years. You're from different institutions. We are not sure what's the kind of training, what's the kind of exposure you've had there. SRM by itself has a culture. Request all of you to be or to fall in line with what is expected out of you. As Sir mentioned, show up. First thing important, be there. 2, learn what is the culture. Stand up for yourself. I would say this, wherever it is, whatever it is, you don't need to feel pressurized. You should stand up for yourself, stand up for what is right, be honest, do your best, and we should be proud of you. Please make us proud, please make your parents proud, and you will feel very happy at the end of the 3 years. Best wishes.
Thank you, ma'am, for your valuable words. It's now my privilege to invite Dr. Nithinam Nagarkar sir, Pro Vice Chancellor in charge, and Dean Medical to deliver the inaugural address.
Thank you. Yes, good afternoon, everybody, and warm welcome for this induction program for the PG students MDMS 2025 batch. Respected Additional Registrar Ma'am, all our beloved Associate Deans, Vice Principal Dr. Bala, Medical Superintendent, our all very learned HODs, faculty members, support staff, which is very active and dynamic here, and my dear students and their parents. I think it's a great day for all of you over here. And I echo what Dr. Kumar has rightly mentioned. He and his team have really put in a lot of hard work for this particular event. So thank you, Dr. Kumar, and your team. So he has rightly mentioned that you all have, put in a lot of efforts to come up to this stage. You know how protracted this particular time, the whole cycle for MDMS admissions have been, right from the first the entrance examinations and then the counseling sessions and the multiple rounds. But I think you made a wonderful decision, and I congratulate you and your family members, and that deserves a round of applause from all of us. You have made it to SRM Medical College Hospital and Research Center. You've just seen that wonderful visual which was created by our communications team. So whether it's the university, it's the top-ranked E++ NAC rated university, 11th in the country in NIRF. The medical school here is 18th in the country, and we continue to progress like that. So coming here has been a great decision for all of you. You have put in a lot of efforts, your parents, your guardians have given their blessings to you, and you have reached this particular stage. So it's a very important day in your lives that you start a new career for yourself. So when we talk of UG medical education, it's a more, overall you're getting a feel of what a doctor would be doing. But here, now you become more and more focused. Similarly, if you go one step later for your DMMCH or your fellowships, you will get more and more specialized or subspecialized as the case may be. So now, you know what's your true calling, you have reached your specialty, and most likely this is going to remain your specialty lifelong. You'll remain in touch with this particular team, your HODs, your faculty members, your colleagues. You learn, that kind of spirit to work together. First, you'll be, working and getting orders from your seniors, from your faculty members and HODs, and you gradually develop the potential when you will actually take up this leadership position. So it's a very, gradual process, but nonetheless a great learning process. That's how all of us have evolved, and we reach a higher level subsequently. But when we talk of this particular college, we've got some excellent human resource. When I talk about that, it's both the teaching and non-teaching staff which is constantly available. Best highly qualified faculty members are there to guide you at every step. We've got a fantastic management, the founder chancellor sir, our pro chancellor Dr. Satyanarayan sir. They're always available and they take keen interest in the day-to-day functioning. Along with that, we have the vice chancellor, registrar sir, and of course AR ma'am and the rest of my team which is here. So everybody is available 24/7. And when I say 24/7, believe me, it is 24/7. It could be a holiday, it could be a weekend, It could be the middle of the night, but our team is almost always available here. So whether it's the teaching or the non-teaching, we've got actually the best human resource over here for you. Physical infrastructure, I think the medical superintendent, Dr. Venkat, has rightly mentioned about the fantastic hospital and the various facilities that we have over here. And please take time out, if it is possible, to visit both the hospital as well as the college to get a first-hand feel of the facilities which exist. And these are really top-class facilities. And we continue to evolve, and every year new facilities are added on. Whether it is the medical college, which will have a wonderful auditorium, state-of-the-art lecture halls, library. We've got a wonderful simulation center, which is again one of the best in the country and largest in the country. A hospital which is 1,500 bedded plus, and we have all the super specialties, and apart from, of course, the broad specialties. And with all this is the clinical material which is available for all of you. So whether you're working in your labs, whether you're working in the ward or ICU, operation theater, each one of you will be exposed to a good number of cases, something which is the most important when we talk of medical education. This is what you're going to learn, and you're going to then recapitulate when you practice or wherever you will be going in future. Apart from that, the university as well as our medical college here lays a great emphasis on research and innovation. We've got facilities for clinical trials and research, divisions of medical research. We've got facilities, being a multi-stream university, you can coordinate with faculty members and guides from engineering side also, something which usually doesn't exist in most of the medical schools in our country. So you have that facility as well. So take all this in your stride. You can really develop into a fantastic professional on your chosen specialty. Many times during post-graduation, we are not sure which PG course we'll enter into. But believe me, each of the courses has a great future. It's up to you where you want to reach. The sky is the limit. You can be a public health expert, you can be a clinician researcher, you can be a practitioner, you can be an academician. During our times, maybe 2, 3 decades or 4 decades ago, there was a limitation in what you could do in your life. But you as medical professionals have a much better chance, to really excel. I'm really happy that all of you have come here today. My faculty members and HODs are always available, apart from all the staff here. I'm sure that you're going to enjoy your stay here, develop lifelong bonds. Like we take pride in you and your presence here, I think we'll take even greater pride when you go out and make a mark for yourself, your family, and of course for the institution. You'll always remain a part of the SRM family forever once you've joined it. And we continue to look after you. So we've got a separate alumni section. Dr. Sundara Pandyan is over here. And we try to remain in touch with our students. We want them to keep engaging with us in future as well. We'll be very happy to know where they are placed and in any way that they can help us or we can help them. So it's that kind of a relationship. So God bless you all. I'm sure it's a great memorable day for all of you. Make the best of it and make the best of this training that you're going to get here. God bless you all. Thank you.
Thank you, sir, for your inspiring and insightful inaugural address. Now we have distribution of admission slips to the newly inducted postgraduates by the dignitaries on the stage and the heads of the respective departments. I request Dr. Balakrishnan, sir, Vice Principal AHS, Professor Anatomy, to take over.
A very good morning to one and all gathered here. So now we are going to distribute the admission slip for the newly admitted students. We'll be going department wise, and I ask all the dignitaries on the dais, request the dignitaries to join by the HODs of the respective departments to issue admission slip to the newly admitted students. So we'll be going department wise, and every department called, I request the head of the department to join the dais. First.
MD Anesthesiology, Dr. Shruti Sugavanam,
Department-wise, and every department call, may request a session and join the class.
MD Anesthesiology, Dr. Shruti Sugavanam,
Dr. Sira Sanskriti Pridarshan. Dr. Sira Sanskriti Pridarshan. Dr. B.V. Abhishek Sundaraman. Dr. B.V. Abhishek Sundaraman. Madam, sir, 1 minute. Sir. Dr. B.V. Abhishek Sundaraman. Dr. B.V. Abhishek Sundaraman. Sir, answer. Dr. Aravindan D. Dr. Aravindan. Dr. Aravindan, yes. Dr. Aravindan, yes. Yes. Dr. Aravindan D. Dr. Rehan Islam Kabir. Dr. Aravindan, yes. Dr. Akshay Nivashini. Dr. Nayantara Suresh. Dr. Vasanta Lakshmi. Dr. Akshay Nivashini. Dr. Ritvik Nivas. Dr. Madhulika Mohan. Dr. Lavanya E. I request head of the department biochemistry to join us. Dr. J. Madhumitra. Dr. Rajkumar Ravi. I request HOD Community Medicine to join us. I request HOD Community Medicine to join us. Dr. B.V. Abhishek Sundaraman. Dr. Uday Kumar Ilangovan. Dr. Anandi S. Dr. Raksha Vigneshwari. Dr. Manoj Kumar K. Dr. Swati Shankar. Dr. Fatima Shamsuddin. Dr. Surya K.
I came to Saudi chasing a new fire, a new challenge. But what I found here goes.
Dr. Surya K. Dr. Swati S. I request HOD Dermatology to join us. Dr. Surya K. Dr. Swati S. Dr. Dhanushri GS. Dr. Alagundala Sai Meghana. Dr. Sanjay Maria Jain. Dr. Karthik Sundaram. I request HOD Emergency Medicine to join us. Dr. Naimi Vinay. Dr. Ranavade Sarvesh Mohan. Dr. Sneha Nivasini KU. Dr. Gopala Krishnan Monica. Dr. Sai Rajarajan ST. I request HOD Forensic Medicine to join us. Dr. Devamani S. Dr. Aravind Kumar N. So next we are moving on to General Medicine Department. Dr. Vinith. Dr. Ovia S. Dr. Sachin K. Dr. Padamanjari M. Dr. James Joshua T. Dr. Mohammad Tarvesh S. Dr. Ishwar Srinivasan. Dr. Ilakia R. Dr. Nirupama Sriram. Dr. Nirupama Sriram. Dr. Shruti K. Dr. Nidimusli Geet Saket. Dr. Padma Mohan. Next we are moving on to Microbiology Department. I request HOD Microbiology Madam to come forward. Dr. Priyadashini MS. Dr. Preeta S. Next we are moving on to Pediatrics Department. I request HOD Pediatrics to come forward. Dr. Swiss Raja R. Dr. Venkateshwaran UC. Dr. Janani NM. Dr. Danesh Krishna M. I request HOD Pathology to come to the dais. Dr. Steffi S. Ma'am, ma'am. Dr. Niveda T. Dr. Divyashree R. Dr. Shweta K. Dr. Kausalya B. I'll start from there. Dr. Sanila Sasikumar. Dr. Annalakshmi L. We are moving on to pharmacology. I request HOD pharmacology to come to the dais. Madam, Dr. Preeti S. Dr. Naveen Kumar P. Dr. Venkata Nagapujita. Dr. Vignesh V. Dr. Tirumurugan Dhanapal. Next, we are moving on to physiology. I request HOD physiology to come forward. Dr. Subhatra S. Dr. Madhumati S. Next, we are moving on to psychiatry department. I request the HOD psychiatry to come to the dais. Dr. Madhumati S. Psychiatry. Yes, sir. Dr. Geeta CS. Dr. E. Varshni A. Dr. Gunakala Sindhu. Dr. Shweta RJ. Dr. Drishya Kandambat. Next, we are moving on to radiology department. I request HOD radiology to come to the dais. Dr. Maila Venkata Siva Sandeep Reddy. Sir, 1 minute, sir, 1 minute. Nandini is here. You didn't sign, ma. Dr. Nandini from psychiatry. Dr. Mullai Subramani Kasturi. So, Dr. Nandini from psychiatry, you should sign the attendance later. We are moving on to the pulmonary medicine department. Sir, photography we are taking, sir. We will give the professional photographs taken. We will send it to the student's mail ID. We are taking professional photographs. Parents, please be seated. Your son or daughter will receive it to their mail ID. All professional photographs taken, we are live recording it. All photographs should be sent to the respective students. No need of capturing in the phones. Please be seated. We are moving into the pulmonary medicine department. I request HOD pulmonary medicine to come. Dr. Rida Hussain Tavalam. Dr. Meenakshi B. Dr. Hari Shivan S. Dr. Balaji S. Pandian. Dr. Arsia Bano. Dr. Hari Shivan S. We are moving on to the next department, ENT. I request HOD ENT to come forward. Dr. Balaji S. Pandian. We are moving on to the next department, ENT. I request HOD ENT to come forward. Dr. Arsia Bano. Dr. Rishi Pranavesh. Dr. R. Surya. Dr. Rishi Pranavesh. Next, we are moving on to surgery department. I request HOD surgery to come forward. Dr. R. Surya. Dr. Renita R.S. Dr. Mohammad Ibrahim T.H. Dr. Arnachalam T. Dr. Akash S. Dr. Roshan M. Dr. Shibu Kannan SM. Dr. Arya Sivakamaran. Dr. Digvijay TV. Dr. Muhammad Akil B. Dr. Vinod A. Next, we are moving on to orthopedics. I request HOD orthopedics to come forward. Dr. Naresh C. Dr. Rajesh PP. Dr. Pinaki Naik. Dr. Ilavarasan U. Dr. Chandra Vijay Shivbose. Dr. Vishwakshena. Next, we are moving on to immunohematology and blood transfusion. I request HOD immunohematology and blood transfusion to come forward. Dr. Aditya A. Kurup. Dr. Nimmi Rachel Thomas. Dr. Rane Pratiksha Prabhakar. Thank you, one and all. Yeah.
That's it. Thank you. Now we have two volunteers from the parents of a newly joined PG to address the gathering. I invite Mr. Palnivel to the stage. Thank you. Now we have two volunteers from the parents of a newly
Thank you, ma'am. I feel privileged and it gives me immense pleasure to welcome the proud parents as well as that PG students for this PG induction programs. Good afternoon to one and all once again. And dear students, today is an important day and all of you are going to wear for the white coat with full of humility and have some kind of the full of patience also. And in fact, from the beginning, Professor Kumar has given that slides, made a very good PowerPoint presentation. He made all that, what are all the SRM are doing it, what is their expectations, and how to behave it, what are all the activities you are going to carry on. Each and everything he has made it. And I feel this is nothing it is very, 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 very easy for you, provided if you are taking it very lightly. And also, the medical superintendent asked a good question to you, why you have selected for the SRM? Because many of them may be aware or some of them may not be aware. Here, many of the parents, I feel, maybe doctors or some of them like me, they are not doctors, they are not in the professional and they may be in the very normal people also will be here. Let me tell you, why SRM? SRM, in fact, in India, there are so many universities are there. Deemed universities are equivalent to central university. It is in the status of the central universities. There are 94 private deemed universities. Out of the 94 private deemed universities, 33 are doing only for the medical education. Then out of 33 institutions, SRM is best amongst the three. How it has become the three? Yes, this is what I need. How it has become the three? Because of the honorable faculty members here, because of their hard work. And in fact, you may be asking how you can say all of the things in front of you. Who are you and how can you say all of the things? So I am in Delhi for the last 37 years. I worked as a 5 minister as a PA. I opted PA VRS and I am working in an organization called Education Promotion Society for India, which is the only national organization who is a research work, having 8,000 institutions across the country. I visited more than 45 countries. I visited all the Ivy League universities also, Stanford, Harvard, and even further, John Parkinson. Everywhere I visited. In fact, even in India also, I also visited for the many universities and institutions. I saw that SRM is one of the best one. And also, it is not only for that, I'm not telling, we are having the statistical data. The data, what I am having it, even I doubt that SRM also having the data or not. Why I am telling, even for the very recently also we received one data for the One Nation, One Subsistence. One Nation, One Subsistence, what exactly many of them doesn't know. The government is giving the privilege for the journals, for the government institutions, whereas private institutions are doing for that Indian institution to promote our Indian education on par with the global standards. For that 80% of that contribution is to be done by the private institutions only. Many of them says private institutions are not equivalent to the on par with the government. It is totally, it is a myth. It's not like that. From the beginning, our professor has told there is no stress, and they are all capable. And then even for the mentorship, what the mentorship that in private institution, particular about SRM, I know very well. That is 24/7 that our Honorable Dean has told. It is true. It is 24/7 also. Because whenever if you are coming over there, if you are asking for any one of the parents, they used to answer. But provided, my dear PG students, you have to utilize the opportunities. You are having for the best mentors. In fact, I can say they are not behaving you like a teachers. They are all like one of the family. Many of the institutions, even in Tamil Nadu also, they will not allow you to speak to the professors. But here it is not like that. Whenever you want any kind of that queries, any kind of that questions, you can very well you can ask. Also, one more thing, let me tell you, SRM has reached in the level of the international level. I don't know how many of them are aware of it or not. Sri Ramakrishnan from that SRM alumni only, he is a advisor, senior advisor to White House, appointed by that Donald Trump. I don't know how many of them are aware of it or not. Am I right, sir? Yes or what? Srinivasan Ramakrishnan. Also, you know that SRM alumni, if you are asking me for that medical, I saw somewhat that 4 or 5 years back, when I visited in that US, I visited for Stanford University. That time I saw that one Mr. Sendil Anand, who are one of the SRM alumni. Even for that, so many SRM alumni are working in Chennai also, and even further across India also. I know all the peoples. This is one of the top 3 institutions, one among the top 3 institutions. And needless to mention about that, our Honorable Dean, sir. If even last week also, I met further Dr. Paul in that Niti Ayog. He also specifically is asking about that, how is Mr. Nitinji? Because he asked me, because he is having that kind of the nature. Even if you are asking me about that Vice Chancellor, the Honorable Vice Chancellor also, he is in the SRM University for the last 25 years. It's very difficult for the person who is working in that 25 years. And if you can able to see for that chancellors and pro-chancellors vision, the visionary is for that the chancellors. Even for that Satya sir, and they are always talking about how to make it for the academically very strong. And they never that, the beautiful thing is, here the management will not interfere into any one of the academic field. They see only for the management, whatever you want, they will provide. And it is for that SRM is having for the global excellence. And you all are having the most privilege, and then you got that opportunity to learn in SRM. And yes, it is true. It's not like you all of you are meritorious students. It's very difficult to clear the NEET examination. I know very well the difficulties. And also, let me also tell you, you people are sitting here, partly we also responsible. You may ask, how we are also responsible? In the year of 2018 also, the government has introduced for the next examination. To stop the next examination, EPSI, our organization, IMA, will fight for that government. Every year we are telling them next is not required because of the reason. Once the people are cleared for the NEET examination, after that there is no need for any kind of the examination. Even the Bar Council also told us, even the Bar Council is to give for the examination. Why not that medical student can't able to give that examination? We told very categorically, the Bar Council is giving that examination to enroll their practice it. It's not like that to study further. So already you people are having the stress. Now this is a field and they cannot able to put more on the pressure. Even we always fight for the future student community also. So this is the way we also doing it, and SRM is doing for the best one. And once again, let me tell you, this is a thing, here as a PG student, I know very well, you may be having to work for the long hours, but you should not have any kind of the tiredness. You should be very smiling. Your one smile will heal the entire patient. You will feel the patient. This is very, very important. You have to be always smile. See, 2 things should be there. One is for that God, one is for that doctors. Both are having the any kind of the times. Whenever we want to pray for the God, anytime we can able to pray the God. But you people are more than the God. The patients are always believing you. They want to surrender to you so that you have to fulfill their desires. You should not show any one of you have to sacrifice yourselves. You have to fulfill that, whatever they want, you have to do it. So this is the way you have to do. And one thing I want to remember here, how to work like that. I'm taking 1 minute more, sir. In fact, when I was in that childhood, my mother used to take me to that doctor. That doctor is on her MBBS, but one of that time in the MBBS is a very big one. To complete the MBBS, he is a child specialist and everything will be there. Syed Khalilullah, that doctor, Syed Khalilullah doctor, my mother used to ask the doctor, Doctor sir, everything is right. थोड़ा सा इसको बादिया कर रहा ना. Sorry, I'm talking in Hindi. Sorry. கொஞ்சம் பாத்தியா ஓதி விடுங்களேன் அப்படி சொல்ல. You won't believe it, sir. He used to come out the chair, he used to put the carpet, he used to do for the batia. This is the way he used to do it. In a smiling face, he used to do it. That way, I am expecting all of you used to have a smiling face and do it for the best. And all of you should come as the shining stars. And you are having that best teachers are here. My dear parents, and all your sons are handed over to the best teachers, best faculty members are here. They will be take care of you. I am expecting, once again, I am wishing all of you in a very good success. All should come up in the field in the excellent shining stars. Thank you very much for the opportunity, sir. Thank you very much.
Thank you, sir, for your words. Now I invite Mr. R. Dayalan to the stage.
இங்கு வந்திருக்கும் அனைவருக்கும் முதற்கண் நன்றியை தெரிவித்துக் கொள்கிறேன். முன்பெல்லாம் நம் சராசரி வயது 55, 60 அது வரைக்கும் இருந்தது. தற்சமயம் அது 65, 70, 75 என்று தாண்டிவிட்டது. அதற்கு முக்கிய காரணம் இந்த பெரிய பெரிய ஆஸ்பத்திரிகளும் பெரிய பெரிய டாக்டர்களும் அவர்களுடைய முயற்சியால் நம் வயது சற்று உயர்ந்து இருக்கிறது. அதற்கு உதாரணம் நானும் ஒருவன். மாணவ செல்வங்கள் அனைவரும் தங்கங்கள். அதை வெட்டி எடுக்கும் போது மின்னுவதில்லை. அதையே நகையாக ஆபரணமாக செய்யும் போது மின்னுகிறது. அதே போல் மாணவர்கள் பெற்றோர்களும் பெரிய பெரிய ஆசிரியர்களும் அவர்களை மின்ன வைக்கிறார்கள். அவர்களுக்கு மாணவர்கள் நன்றி கடன் செலுத்துமாறு கேட்டுக்கொள்கிறேன். உதாரணத்திற்கு இங்கு மரம் செடி கொடிகள் இருக்கின்றன. மரம் நிழலை கொடுக்கிறது, ஆக்சிஜனை கொடுக்கிறது, மழை வருவதற்கு வாய்ப்பை கொடுக்கிறது. அதே வெட்டிய பிறகு ஜன்னலாக, சிற்பமாக, பெஞ்சி சேராக வடிவமைக்கிறது. அதே போல் நீங்களும் உயிரோடு இருக்கும்போது இரத்த தானமும், இறந்த பிறகு உறுப்பு தானமும் செய்து உதவுமாறு உங்களை கேட்டுக்கொள்கிறேன். நன்றி, வணக்கம்.
Now I request Dr. K.V. Leela ma'am, Associate in UG Studies, to propose the vote of thanks.
With immense gratitude, I stand here to deliver the vote of thanks. I thank our management, Honorable Pro-Chancellor Academics, for blessing us all, even though they are not here because of their busy schedule. And I thank Honorable Pro-Vice-Chancellor Sir and Dean, Dr. Nitin Nagarkar Sir, for all the supports and unwavering help. And I thank our additional registrar, Maithili Madam, for all the valuable inputs she gives for the institution's development. I thank Dr. J.S. Kumar, Associate Dean, Postgraduate Studies, Dr. Venkatraman, who is the medical superintendent, who addressed you all for this day and who will be guiding you throughout your course period here along with us. I thank Dr. Satyanarayanan, Dr. Logaraj, Dr. Balakrishnan for my own associate deans for their presence here and supports. I thank my fellow professors, all the HODs, my dear faculties for being here to grace the occasion. And I thank the postgraduates who danced today to entertain us for entertaining us and setting the stage for a warm. And I immensely thank the parents who are here, and I thank the parents who addressed for us Mr. Palanivel sir and Mr. Dayalan sir. I thank the postgraduates who have chosen this institution and joined this esteemed SRM institution from today onwards. Your achievements are going to be the growth indicators for this institution in a bigger way. We believe in you and we trust and say that your stay here will be very, very enjoyable as well, learning to the max. And wish you all good luck. And I thank you all for being here. And I thank all the supporting staff, the administration, ITKM, and all the people who have helped for gracing this occasion or making this occasion a happy and a successful event. And once again, I thank you all for being here. Thank you.
Thank you, ma'am, for proposing the vote of thanks and your thoughtful words. Now I request everyone to kindly rise for the national anthem.